Thank you for joining us. So we're going to talk to you about how you can include equity in all Cochrane reviews and how you can fill in the review template using the new focus review format. Um, so thanks. So just to get started, we'll give you a bit of an introduction to what we mean when we're talking about health equity. So we define health inequities as differences in health outcomes that are unnecessary and are also avoidable. And they're often linked to systemic and structural barriers to health opportunities across socially stratifying factors. Next slide, Jordy. So equity and equality are not the same, and inequity and inequalities also aren't the same. So some differences are unfair, but some differences are inevitable. So inequalities are just differences. Health inequalities refer to differences in health outcomes. So things like natural biological variation, next one, health damaging behaviors, if you freely choose them. So there might be something that seems unfair, like an accident in sports or other pastimes. But if the person has freely chosen to do that, then we wouldn't consider that to be an inequity. So these are health inequalities. And then the next one, Jordy. So things like lifestyle restrictions and exposure to unhealthy or stressful living and working conditions, or inadequate access to essential and other public health services, these would be considered inequities. So inequities may result in differences in baseline risk of a condition or a problem and could lead to differences in the way an intervention works. Next slide. Our group uses this acronym, Progress Plus, to help systematic reviewers think about the characteristics that might stratify health opportunities. And then how they can use this in the review, we'll tell you about over the next few slides. But progress stands for place of residence, so where somebody lives, and then race, ethnicity, culture, language, and ancestry, occupation, which includes underemployment and unemployment, gender and sex, religion, education, socioeconomic status, and social capital. But the Progress Plus part includes additional personal characteristics that could be associated with discrimination, like age or disability, features of relationships. So if somebody's excluded from school or lives in a house with parents who smoke, and then time-dependent relationships. So where someone may not be always considered to be at a disadvantage, but would be for a short period of time. Next slide, Jordy. And then keeping these progress characteristics in mind, it's also important to think about whether an intervention itself can also generate health inequalities or worsen health inequities. So some examples of these could be things like media campaigns or printed educational materials, if these are your intervention, as these could increase inequities because of differences in education or health literacy levels. So just keeping that in mind when we're thinking about our systematic reviews. Next slide. So there are three main types of intervention review questions that we can think about when we're thinking about health equity. Most of the guidance so far has been for equity-focused reviews, which fit into probably categories 2 and 3 here. So where interventions are targeted at a disadvantaged or an at-risk population. So there might be equity outcomes that you could examine to see about reducing inequities, or where there's interventions aimed at reducing social gradients across a population or among subgroups. But the first type is interventions aimed at the general population, but where there could be opportunities to explore differences in some of the Progress Plus characteristics. So now that we've done a brief introduction to health equity, we can tell you about how to include equity in your reviews. So first, there is a chapter in the Cochrane Handbook from 2019 that looks at equity in specific populations and sets out how you can plan your review to include health equity considerations. Next one, Jordy. And then there's also an interactive learning module that talks about health equity in systematic reviews. And the next one, Jordy. And the newest is that in RevMan, there's now a section that you have to report on called equity-related assessment. So what we're going to talk to you about today is how to fill in this section of your review and also how to carry that throughout the whole review. So next one, Jordy. Jordy, can you change the slide?
I think we lost Jordy.
We lost Jordy. Okay,
Well, it seems it is his
he's
computer
frozen.
is frozen.
Let me take
Yeah.
over the slides.
So do you have your the
Yeah, it's all
slides
ready to go.
prepared?
Yep, I
Okay,
can
so just
just
share the
grab it.
screen.
Yeah. This. Okay, and just share it. Let me just see if I can make it share just this though. Okay, there we go. So now you can see the slides again? I'm assuming.
Yes, we can.
Okay, perfect. Okay, so in the equity related assessment, there are 6 main ways that you can think about health equity. And we'll also tell you about how you can carry these throughout the other parts of the review. So the first is to think about health equity when you're planning your question and maybe consider using a logic model. Think about who you should engage to improve your review. Think about the methods that you might use to identify and appraise the evidence related to equity in specific populations. Describe what you find in your included study. So what are the characteristics of the population that you've included? And then think about how you could report this information in summary of findings tables, and then also how you might interpret that in the discussion of your review. So first, we'll talk about the question stage. So when you're thinking about your review question, you can describe who's affected, so who might experience the problem or the condition differently, and think about whether there's differences in baseline risk, whether different groups of your population might experience the intervention differently or may have different access to the intervention. You can think about how social structures could affect that condition, so whether people might experience it differently because of things like sexism or ageism. And then you might want to present a logic model, which can provide a visual description of the mechanisms between how the population characteristics relate to the intervention and how the intervention is delivered. So I do have an example. So this is an example of a logic model. It's pretty complicated, this example, but you can see that on the left side here, we've got some child factors and community factors that relate to health equity. And this logic model shows how these authors thought that these could influence the health outcomes and the mechanism of action of the intervention. So the feeding programs are affected by the baseline nutritional status. That also affects the implementation of the intervention, and the community factors can also influence all of these processes along the way. So just it might help you think about how and where you might assess equity if you map it out in a logic model like this. So for example, and then this is an example of thinking about the reporting of the condition and the baseline risk. So here you have the rotavirus vaccine review, which we use all the time because it's a great example of an equity focused review. But in their description of their condition section, they do comment that rotavirus deaths are most often occurring in low and middle income countries. And then there's another review that looked at communication strategies for COVID-19, and they found that inequalities are influencing the degree to which individuals and populations are able to accept and adhere to these COVID-19 preventative measures. Okay. So then this was Jordy's part of this presentation, but he'll be joining us again soon. He's just having computer trouble. But what we often find is that this is just too complicated or it's too much to think about in your review. So what we're going to do here is present you the ways that you can include it and then sort of soften it with here's like how you can start thinking about it. So the first is you don't have to solve every equity question at once. You can prioritize maybe a few populations that you know could be experiencing the biggest differences. So like in the rotavirus review, they were able to focus on the mortality rates within the country, and they can compare the high mortality, low mortality, and medium, risk of mortality from rotavirus in their review. And then You can look for any potential inequity signals in the data. So are there populations that you expect to see not included in your studies? Or is there a group that you would like to know about how this intervention works, but the studies aren't including them? Then you can also include that in your review. And then it's also always okay to say these are things that you would like to explore, but you can't do it now. And then it's flagged. And when you update the review, it's something that could be considered. Okay, so that's the first part about the question.
So
The
Jennifer,
next, yes.
Jennifer, can I just, first of all, Jordi is back.
Oh,
I don't know if
perfect.
you're aware.
I can't see him, so.
Yes, okay. And also we got a request from audience that if you can slow down a bit.
Always, that's always a request for me. Sorry.
Yeah.
Okay.
Okay.
Okay. So I'll do the second one and then Jordi will take back over.
Yeah.
So the next part is which interest holders should be engaged. Now my slides aren't working. There we go. So with our work with the multi interest holder engagement group, we've identified 11 groups that you might want to consider engaging when you conduct an evidence synthesis. So these include groups that are usually included, like providers of care and patients. And then we've also included these other groups, like people who are funding research, people who are running programs, like health-related programs at the community level, people who are making policies, or people who are commissioning evidence syntheses. There are resources from the Cochrane Consumer Group about how to do engagement and how to engage with people. But with equity-focused reviews, we want to also think about including people who are experiencing health inequities and including their input in the planning of your review and in the conduct of the review. So making sure that the outcomes and the questions that you're asking are relevant to the people who are experiencing health inequities. So I do have an example. So there was a review about mobile apps for mental health, and they engaged youth, because that was the focus of the review, as co-researchers who helped them define the research question, select appropriate outcomes, and determine the approach for analysis. And so then those youth members also participated throughout the review in selecting the articles, interpreting the findings, and helping with the final report. And so the author said that their engagement was necessary to help understand the gaps in these applications for youth that experience a depressive disorder and alcohol use. And then that's too complicated is also something we often hear about engagement in general in all types of research. So we're just saying here, you don't have to involve all types of interest holders, but you should think about them and then select who could be the most appropriate to include. And then again, if there are groups that you would like to include, but you just can't, it's not possible, then you can report that in the review, and that would help to plan for future updates and plan for future research. Jordi, I can control slides for you.
Thank you, Jennifer. So at the point that we have decided what is the question, the equity aspects that we want to look at, and that we also have looked at what are the interest holders that we want to get involved, it's time to think which methods we can use to identify and appraise evidence that is related to equity in specific populations. So next slide. So we can look at the methods in almost every section of the review. So if we look at the searching, we may want to consider whether there is some databases that are more likely to have the population that we are interested on. And sometimes that means that you may need to go beyond the health databases. So for instance, if you are thinking that for your intervention, some low socioeconomic status population may have a differential effect, maybe some economic studies have been looking into that, and therefore you may consider looking to equally. No, if you are looking for some other aspects that are more driven by social aspects, no? Like could be people living in social deprivation, homeless, any other thing, maybe sociological abstracts is a space that you may want to consider searching. You may also think whether what are the study designs that you want to include in your review. Some study designs are more sensible for equity questions. And if you really think that this is the most important piece, you may want to consider including other study designs as far as they fit your research purpose. You also may want to think which outcomes you're extracting. So like sometimes you have a core outcome set and you say, well, this is what the community has decided is important for the clinical aspect. But sometimes some equity populations may prioritize other outcomes. No, for instance, some people that work for the hour may favor outcomes such as return to work as more relevant for them, because that is going to show them not how well are going to be, but how fast they're going to be well enough to be able to be back at work. And that could be a much more relevant outcome for this population. So consider where there are outcomes, especially for your secondary ones, that you may want to also include into that, and definitely check with your interest holders about them. You may also be looking to different analysis strategies about how you are going to look into the data to unfold all the equity data that we have encountered. You may want also to look carefully at the flow of participants in the studies to see what is how the participants were recruited, whether they did an extra effort to recruit these equity deserving populations, whether there is some barrier for recruitment, and whether there were the retention of patients in the study was also suffering from inequities, or some groups were more vulnerable to be lost from the study. And also a very important aspect for equity is look at how the context setting is affecting the intervention. No, sometimes the way that you deliver the intervention make it more desirable or less desirable for equity deserving populations. Sometimes the context makes the intervention is working differently. No, it's not the same to be in a hospital in a high-income country with all the bells and whistles than in a refugee camp in there. There is that setting changes the way the intervention works, and it's good to get a reflection on how that works. Next slide. So on the method section, you may want to define which information you are going to include in the characteristics of included studies and in the result sections related to equity. Think which is the information you can reasonably be able to collect and how to present it in the most effective way. Consider reporting on the equity methods to appraise the evidence related to equity and specific populations, and also describe the experiences in the life experience of these on these populations, and also very important. And again, another aspect where the different interest holders may help you to analyze this information. And also describe the rationale for any methodological decisions. So if you are going to choose to do some group analysis, you should not throw away all the guidance on the Cochrane handbook about the warnings about subgroup analysis. You need to really think that this is very well thought, that you have a causal pathway why this is going to happen, and justify why you're choosing a particular outcome, what is your eligibility criteria, so that people can understand how you reach to this point and how is that going to inform your review. Next slide. So, and here we have some examples of equity relevant considerations. So, for instance, on the review of corticosteroids for COVID, so you can see that they reported about age, sex, and ethnicity, as well as comorbidities. Now, you can see that there are some clinical aspects, but also some equity relevant aspects. And also responding some aspects like a place of residence, occupation, religion, education, socioeconomic status, and social capital, because these are elements that may help understand the context when the intervention is happening. And again, looking at that, they also decided that sex, age, like older than 70, younger than 70, could be aspects that they could be stratifying the outcomes for, and therefore show the results, as well as high versus low and middle income countries. In another review that is more focused on equity, looking at indigenous early childhood well-being, they reported the rationale for including non-randomized studies, no? And basically a way also about how working with indigenous populations often leads that these kind of studies are the ones that are providing more information. And also the studies, the authors plan to organize studies by indigenous population and child's age, although they were not able to do that. And that's also fine. So don't, well, actually, let's go to the next slide, just going ahead. So for that's too complicated, the things that we want to consider, sometimes we have this complaint about, oh, the primary studies won't have this data, so why we want to do that? And I will say, well, first of all, if you're looking for it and you're highlighting that we look for it and the studies do not have this information, that's already valuable. We can just say this information is useful in order to inform the people who are going to use the review, and it's not available in the primary studies future primary studies should do better and provide this data. You may also say, well, actually, the question for the general population is already resolved, but we have questions whether the efficacy is the same on these particular settings, because we have a rationale that the intervention may not work as well, or may have different considerations. So that could drive to say, well, there are subgroups of the population that we benefit for further research. So that's another thing. Another element I would like to highlight is a lot of times, like in a methodological study that our team did, realized that there was more equity relevant information available in the primary studies than it was in the evidence synthesis. So it could be important to highlight that a lot of times just dropping the ball at the beginning, saying we're not going to find it, means that fewer studies that have it, you are also obscuring this information to be there. You may say, well, it's a lot of work, it's a lot of things to screen, we don't have resources to do all that, that will increase a lot of time. That's fine. You can just say, okay, what is reasonable for you to do? You can highlight what are the things that you were able to do and the things that you would love to have done, but you did not have the resources to do it. Because that can help other researchers to cover this slack. They may do a focus review focusing on these aspects, or a future update of the review, they may just focus on these aspects and not look at all the other ones. So we don't need to do it all at once. We can also pace ourselves. So back to you, Jennifer.
Okay. So then the next is describing what you found in these studies, in the included studies, describing them in the review. So we want to report the characteristics of the populations that were considered, and then summarize them across those studies if you can. So you're already collecting the characteristics of your included studies, because that's always been a section of a Cochrane review where you have a table per study that describes the PICO of that study. And what we're suggesting is that you put that information together across the study so you can see what's there in the full body of the evidence. So something like this. So when you present the results of the review, you have your inclusion criteria. So you can say who you were looking for. So this review was looking at falls, preventing falls. And so they're expecting to find that people were over 60 years old. They're expecting to find that fall prevention programs would be for everybody. And they're expecting to find that any country could conduct an intervention that looks at falls prevention. And then you could also look at any other characteristics that might be important for your question. But then when you present the results of the review, you should comment on what the body of evidence looked like. So the studies that were included older adults, and the mean ages were above 70. The majority of the participants were women, usually over 50%, but maybe over 70% of women. And then most of the studies were conducted in high-income countries and mostly in urban areas. So just commenting on what you found in the evidence. And then you also can critically appraise this information. So using the same items that we talked about in the methods, you can say whether the relevant study designs, whether they were appropriate for collecting the information that would answer your equity-related questions or provide you with equity information. Were the outcomes important to the people who were experiencing inequities? Was there an appropriate analysis strategy conducted within these studies? And then looking at the flow of participants and the recruitment and retention. So were there more dropouts from certain populations? Did they recruit populations that you expected to see? And think about that for your populations that you're interested in. And then also think about whether there was anything happening with the intervention that could be related to population characteristics. So the context and setting that Jordi has mentioned. And so here in the That's Too Complicated, so collecting and reporting all this information might add a little bit of work to the review, but you are including these population characteristics anyways. So we're just saying you should put them together and look at what happens across the studies instead of each study individually for describing the population. And then this deeper description and deeper appraisal of the population of the studies can help you better understand what's happening with the evidence, and also could help it be more useful for anybody who has to use the evidence of the review for policymaking or clinical decision-making. It makes your discussion richer because you have a bit more of a better picture of what's happening instead of just sort of an average of what's happening for anybody in the population. You can comment specifically on who's been included in your studies. And then again, if you can't report on that information or the studies don't have that information, then you just make explicit that these are things that you would have liked to explore, but you weren't able to, and explain that that's something that could be taken up in a future update of the review. Back to Jordi.
Thank you, Jennifer. This is a topic that it's very straightforward. So let's go for it. Next slide, Jennifer. So as we know, the summary of findings is a very useful tool that we have in order to summarize the results of our review. Oftentimes, you may have that when a review has a particular objective to look into equity, that it may be useful to think how you're going to organize the summary of finding table to more effectively unfold these effects on equity. And you basically have two options. You may want to have two separate summary findings tables. So for instance, have a summary finding tables for studies done in high-income countries and summary findings tables for studies performed in low-income countries, for instance. Or you may want to show it as different rows of different baseline risk. So we can see some examples of that. And you can see, for instance, here, this is the reviews on the rotavirus vaccine, that the results were quite different in settings with low mortality versus settings with high mortality. And they decided that the best way of showing that was to present it in different summary findings, also thinking that the policymakers of countries with high mortality, they will not care to look about what were the results for low mortality settings. However, we go to the next slide. For this review on compression stockings for people taking long-haul flights, you can see that they decided to show the low-risk population and the high-risk populations on the same settings, thinking that the people who were going to use this summary findings table, likely they are going to see both kind of people at the same time, so that both information is relevant for them. And then seeing the difference of the low-risk versus the high-risk population on the same table was more informative. The key point here is to think what works better for your research question, for your equity population. Do you think that people that attend this population are only going to see these populations? That probably the summary as unique summary findings is better. And if you think that they are going to see a mix of these populations with low risk, high risk, then probably the same summary findings, so they need to see both at the same time, will be more helpful. So next slide, Jennifer. And that's not too complicated. I think that's something very helpful that you can just do. But basically what you want to think is saying, well, is think a bit what is the most effective way of presenting results of the summary findings tables. And if you say, well, I don't really think that is going to be that different for my equity populations, then don't worry. So you don't need to present different summary findings tables. You are done. Back to you, Jennifer.
Okay, and so the last one is interpreting the findings related to health equity in the discussion section of the review. So here you can discuss the applicability of the results for different populations and settings. So think about whether you found anything. So are there differences in the effectiveness of the intervention, and why might that be? Is it differences in the importance of outcomes? You can also include that in the discussion. So anything here that you've done all the work related to your summary of findings table and thinking about maybe the dropouts from this primary studies, or thinking about who was included and maybe who was excluded from your included studies. In the discussion, you can just write about what that might mean and how these results might be applicable to somebody in another setting or for different populations. Same as you do anyways, just now with the health equity focus. So for example, the corticosteroids for COVID review reported that their included studies were mostly from high-income countries. So they had a small percentage from middle-income countries, and none of their included studies were from low-income countries. So they reported in the review that these results might not be applicable to lower resource settings because the intervention might actually work differently there, because there could be differences in standards of care, but there could be other constraints like differences in availability of oxygen or respiratory support within the hospitals. They could have differences in availability of hospital beds. So they're able to comment that there might be a difference in the intervention here because of the sort of the setting and the context of the intervention. And then another review that looked at interventions to reduce tobacco use among young people who experience homelessness reported that they found only included studies that were conducted in the USA or the UK. So the results might not be generalizable beyond those settings. And anywhere where their systems for supporting people who experience homelessness are different. So just commenting on it's okay that you didn't find evidence within those places that you wanted to find evidence, but just commenting on then the results might not be generalizable and what might be happening there. So the key points is you should think about health equity from the beginning of the review, but then all the way through. So there's one section to report in the review, but in order to report it well, you have to start thinking about it when you're planning your protocol and thinking about your question that you're going to ask. You can define health equity in the context of your review and think about whether you have specific health equity questions or not, and that's okay. Describe the relevant Progress Plus characteristics for the populations in your studies and how you're going to look for that information and how you're going to report it. And then you'll have to choose or develop methods that will help you answer those equity-focused questions. And then, again, it's not that complicated, because you can just make explicit the things that you would have liked to do, but you couldn't have done. And that will help flag what could be done in future primary studies, but also in future updates of the review. And one big thing is we would recommend don't rush to conclusions. So if the absence of those populations from your studies, if you can't find information about specific studies you're interested in, that doesn't immediately mean that the information doesn't apply to them, but you can use the information that you do have to make an assessment of whether you can say that the intervention might work differently. And so one of the examples that Jordi likes to use is the COVID vaccine reviews, because people who were immunocompromised were excluded from most of the COVID vaccine primary studies, but the results of the review didn't say that the evidence wasn't generalizable to them. And then we did roll out vaccines that included those populations. So this is just a reminder. In the equity-related assessment, we want you to think about equity from the question formulation stage. You might find something like a logic model can help you think through what could be the impacts of health equity throughout the review and what populations could be affected differently. Think about who you should engage and how you can include people who are experiencing health inequities if you have questions that could be benefited from having populations experiencing health inequities. Think about the methods you're going to use to identify and appraise all the evidence. Think about how you'll present the results for the populations that were included in the studies that you've got in the review, and how that might affect how you present your information in a summary of findings table. And then think about how you'll interpret the findings related to health equity in the discussion of your review.